So dementia, like we said, is a very complicated disease where people can start wandering away from the home. They forget things. They start being very difficult to redirect. They become so difficult to take care of. It's just a very complicated disease that families sometimes get to a point where they don't know what to do. But Tamara, when do the families decide when to take them, when to get home agency involved or nursing home involved? When does that happen?
Well, I really think it starts with the assessment from the doctor. I would go to the person's personal doctor and explain exactly what's happening at home. And then you know your family member better than anybody. Does that person want to stay at home? And is it possible? So is it possible because, it's home care can be pricey, but both home care and other services can be pricey. So I would just consider the whole person. Because like when my mom was sick, she didn't have dementia, but when she was dying, she really wanted to be home. So I created a plan and did whatever I could to rally my family around, hire caregivers, and got her, created an opportunity for her to live well at home for as long as possible. But that was her personal preference. Like, if your person, even if they have dementia, if they would prefer to be home, are they safe? Are they wandering? Are they, are there a lot of fall hazards? Like, are they leaving pots and pans on cooking? And like, what are the circumstances? That's what I would ask myself. And then get my doctor to assess the situation, tell the doctor everything, and then go from there. The doctor can make a recommendation on, okay, what is best. But I would definitely have the person their wishes.
Their wishes.
Consider their wishes and consider what's possible.
What's possible, yes, because like I said, this could be a very complicated disease. So what's possible and what are the options? The doctors will advise you.
Correct, yes. But it is painful. It's very painful for me to watch my grandma because I just wanted to talk to her and she was not really responsive and didn't have the short-term memory, like I said, and realizing now, I wish I had those cards where I could have those conversations with her to talk about the things from her past, because she really seemed to remember the things from the past very powerfully.
Yes. Long-term memory, yes.